Hi, my name is Roxanne Kuhlemeier. I've been LPN for 31 years. I'm currently enrolled in the LPN to BSN program at Indiana State University. I also work in care management here at KSB Hospital. Community health nursing is a combination of nursing and public health practice that promotes and protects the health of the population. For my community health project, I'm going to talk a little bit about vaccinations, the importance of them, how past pandemics led to the flu vaccine, and influenza impact on public health. There are two types of vaccines. One is a live attenuated vaccine. That one is a weakened form of the germ that caused the disease. There's still no way you can get the disease from that vaccine, though. It does offer long-lasting protection, sometimes even lifetime. It does require 2 doses to achieve maximum immunity. It can cause some life-threatening infections in somebody with a weakened immune system, such as an autoimmune disease. A couple examples of those are MMR, which is measles, mumps, rubella, varicella, or chickenpox and shingles, rotavirus, which is a severe form of gastroenteritis. There's also non-live vaccines. They are a killed version of the germ. Protection does fade over time, so you do have to have multiple doses of this to achieve a maximum immunity, or yearly doses of this. They are much safer for people with weakened immune systems, but you do not want to take them if you have a history of Guillain-Barré syndrome, and you will know what that is if you had it, or that you are allergic to eggs. Some examples of that are flu vaccines, COVID vaccines. You have to have those both yearly, meningitis, and DTaP. Vaccines work by imitating an infection. Vaccines engage the body's natural immune system to fight off the infections. They work on weakening or killing the bacteria or the virus. This is according to the CDC. You can't really talk about influenza without talking about the vaccines, how the vaccines came about, and talking about those pandemics. There are different strains of the vaccine that come about every year. So that's kind of why you'll see some numbers on here and some letters as well. Viruses do mutate, like I said, the different strains. Start off with 1918. That's the Spanish flu, H1N1. It did last about 2 years and did cause more than 20 million deaths worldwide. 1915, we had the Asian flu, which is H2N2, lasted until 1958, so about a year. 1.1 million deaths recorded worldwide. About 1968 was the Hong Kong flu. It did H3N3. It did last about a year as well. That one did, from that pandemic, researchers developed specific strains of flu viruses or flu vaccines. That pandemic did last about a year, and again, about 1 million deaths worldwide. The avian flu was the bird flu. That one people might remember. It was H5N1. That one led to the pandemic flu response. There was reported 878 countries, and less than 500 deaths were reported. So that's phenomenal. 2009, we had the swine flu, a new version of H1N1, did cause 61 million illnesses. Only 12,400 deaths reported. Those deaths were mainly people younger than 65% at 65 years of age at 80%. So that's a significant for younger people. So once a vaccine gets approved by the FDA, the vaccine is then sent to the ACIP, or the Advisory Committee on Immunization Practices. They are a group of medical and health professionals that develop recommendations on how the vaccine should be used and the safety use of those vaccines. So a little bit of history on those. The 30s to 40s, the first flu vaccine was approved for the U.S. military. 45 was approved for non-military use. And those were done, 1945 was done by the ACIP. 1960, due to that H2N2 pandemic, flu vaccines are recommended for everybody at high risk. 1968, specific flu vaccine strains were recognized. Of course, that was with another pandemic. 2002, they were approved and recommended for children aged 6 to 23 months annually. In 2008, they reapproved it for 6 months, 18 years. Not sure why they did that, but they did put out that recommendation. H1N1 strain led to the vaccine preventing pandemics. 2019, 2020, flu vaccines prevented an estimated 7.5 million illnesses, 3.7 million provided doctor office visits, 105,000 hospital visits, and about 6,300 deaths. If you remember 2020, late 2020 was when the COVID vaccine came about as well. So that was a good thing. Strong defense against the flu, of course, is to get vaccinated. Who should get vaccinated? Everyone should get vaccinated. Any pharmacy can do it, healthcare provider offices, public health clinics. Here at KSB Hospital, we do offer drive-through flu clinics, which I'll get to in a few minutes, that are also related to community health. When, as soon as possible, it does take 2 weeks for the vaccine to become effective. Here's a drive-through flu clinics. It is free to everyone. You just don't even get out of your car. You just drive through. We give you the shots, and you keep on your way. As of right now, the COVID vaccine will not be offered on those drive-through flu clinics. Just watch the news and check with your pharmacies or your physician's office for those when those are going to be out. You will see my smiling face at some of those vaccine clinics. So if you want to see me there, come on in. Why is it important to get your flu vaccine every year? Flu viruses are changing constantly, as we saw in those pandemics. The flu is updated every season to protect against the virus that the research thinks is going to be the most common and the most severe that year. Some key reasons to get your flu vaccine. Getting your flu vaccine yearly does prevent hospital visits, hospitalizations, and deaths or provider visits. They can cause exacerbations or flare-ups of some chronic diseases. And those, for examples, are COPD, diabetes, heart, kidney, and liver diseases, and history of strokes. While people may get vaccinated, still may get sick, flu vaccines have been proven to be shown in several studies to reduce the severity of the illnesses. If you are pregnant, the flu vaccine has been shown to help protect the baby from influenza infections for several months after the baby is born. Other important facts to consider: if you do work, getting the flu vaccine can decrease your risk of having to use sick or vacation days. Also, if you have flu, you're not able to work most of the time, and that can cause an economic strain on your family. If you do have school-age children, it's important for them to get the vaccine to decrease their risk of influenza as well as missing school. You have to stay home with them. They can't go to daycare, again, putting risk of economic strain on your family. There are a few side effects of the vaccine. They're typically pretty mild. You can get headaches, sore throats, some stuffy noses, fatigue, and of course, soreness or redness at the injection site. So myths and facts, because everybody has those myths that float around. So here's a few of them according to CDC. Vaccines are not proven to prevent the flu. Well, you are about 60% less likely to become infected with the flu virus. If you do get infected, of course, the severity has shown to be much less than severe. The flu vaccine can give you the flu. Not true, 100% can't do that. The flu virus used in the flu shot are dead, so they cannot cause the infection. You should wait to get the vaccine, some covered through the end of the season. Studies show you should get the flu vaccine as soon as possible, as it does, again, take 2 weeks for the antibodies to develop in your body. The flu shot will protect me from every type of flu. Not true. The flu shot is designed yearly to protect against the highest risk circulating strain of that influenza virus. People get confused on the symptoms of cold, flu, allergies, and COVID. I'm just going to touch on cold and flu a little bit. Fevers are rare with the cold. You might get an elevated temperature, but not a true fever. Influenza typically does have a fever, and it can last a few days. It can get up to 103 degrees. Headaches, you don't usually get those with the cold, so you might get a little bit of head pressure, but not a true headache. They usually are intense with influenza. General body aches and pains is slight with the flu or cold, but usually severe to mild to severe with flu. Weakness or fatigue with influenza can be intense. Extreme exhaustion. You might get a little tired from the cold, but extreme exhaustion for the flu is very common, usually starts pretty quickly. Stuffy runny nose, common with colds, sometimes with flu. Sneezing, usually with colds, not always with influenza. Sore throats are common for both. Coughing, the flu can be pretty severe. If it does happen, it is common. It can be mild to moderate with the colds. Shortness of breath is rare for both of them. When I worked in physicians' offices, I would get calls all the time saying that people had the flu. You'd ask for their symptoms, and it would actually be gastroenteritis symptoms or stomach flu. The flu only affects the respiratory system, does not affect anything else besides that. Gastroenteritis affects the GI system or the stomach flu. It's just the stomach and intestines. Symptoms of that are nausea, diarrhea, vomiting's in there, headaches, elevated temperatures, temperatures up to 100. 100.9 is elevated temperature, and quite some headaches. Why get the vaccinations? Vaccines prevent diseases that have not gone away. Most of viruses are a plane ride away anymore. So it's very important to get those vaccinations as a child and as an adult. Vaccines do keep you healthy. They're very important for your overall health as well as diet and exercise. They can make the difference between life and death. They are fairly safe unless you have past reactions to them. You do not want to get them then. Most of them are made with some kind of egg protein in there, so you want to avoid them if you're allergic to eggs. They cannot cause the diseases they are designed for. Again, they're weakened forms or they're a killed virus. Young and healthy people can get very sick as well, as we've shown in the past with the COVID virus. We did have a lot of young people that were very sick, and some did not make it through that virus. Vaccines prevent diseases that are expensive. Again, if you have to stay home because you get sick, that does put an economic strain on your family. Because you have to stay home, your family has to stay home, it can get a downward effect. If you get sick, you're putting your children, grandparents, grandchildren at risk, especially if you're around them before and after you get sick. Your family and coworkers need you, of course, to remain healthy. There are a lot of diseases that we don't see anymore because of vaccines. Again, most of these are plane rides away. Third world countries have them. Polio and smallpox. I have seen polio in the past, not very much. Smallpox, I've never seen in my 31 years. Diphtheria, tetanus, and pertussis, which is whooping cough, pertussis. I have seen all of those. You definitely want to get those shots when you're younger. They do recommend them for older people as well. Measles, mumps, rubella, haven't seen much of those. Haemophilus influenza type B, I have never seen that in my 31 years. Rotavirus, if you've had it, you don't want it again. If you know somebody's had it, you don't want that. Definitely as a child, you get that vaccine. Varicella is chickenpox and shingles. Chickenpox, we used to have chickenpox parties when I was young. They don't do those anymore. Again, chickenpox is something you have to stay home for because the child has to stay home. Shingles, if you ever had them, you don't want them again. If you know somebody's had them, you never want them. So you definitely want to get vaccinated for that as well. Once you turn 50 is when the vaccine starts. There are some types of pneumococcal diseases also that we have shown to prevent those diseases due to the vaccines. Things you almost forget. There's some history of vaccines. These quotes are kind of older, but they're still very important. The first one is from the Journal of Marketing, Access, and Health Policy. Vaccines have made a fundamental contribution to the prevention of numerous infectious diseases worldwide. Again, this is a little bit older. It's estimated that the vaccine prevented annually 5 million deaths caused by smallpox, 2.7 million cases of measles, 2 million cases of neonatal tetanus, which is childhood tetanus, 1 million cases of pertussis, again, whooping cough, 600,000 cases of paralytic poliomyelitis, that's polio, and 300,000 cases of diphtheria. The next one is by Dr. Seth Berkley. He is the CEO of Vaccine Alliance. He says a healthy child is more likely to go to school and become a productive member of society in later life, while their families can avoid the often crippling healthcare costs that diseases can bring. This is important, as this important study shows, this is enough to save millions of people from the misery of extreme poverty. To realize these figures, we now need to redouble our efforts to ensure every child, no matter where they're born, has access to life-saving vaccines. Here's some references I use. Most of them are from the CDC, and I appreciate your time. Thank you.